Have you ever had the feeling of what to do when you don't know what you're doing? What about when you're stuck and you're stumped and it's a complex case, or it's a new body part or a new procedure that you've never had to manage? Well, in this episode, I'm going to share what to do when you don't know what to do as a cash-based physical therapist. Hi everyone, welcome back to the episode, and welcome all new listeners, and welcome back to those who heard my content in the past. Today we're going to be talking about what to do, the confusion between not knowing what the next steps are, where to start, where to begin, how to begin a program for a cash pay patient, and I'm going to dive into that. But before I do that, what is new in life? What is better? My back is actually feeling amazing for those who have followed. I'm still not 100% pulling from the ground just because I don't want to go back to that same feeling. It doesn't feel great. It's not what I want to do in life again. It took me about a good 3 months to really start to feel good again, and that's with like really modifying a little bit of everything. What else? I went on date night with my wife. That was fantastic. A local restaurant in San Diego. My kids are doing fantastic. We're a few weeks away from our Disney cruise. Those who've been following, I'm just excited about life. Life is really stable, nothing too crazy, and on to kind of all these new projects that we've been going on. For those of you who asked last week, we did release our new project on Instagram. If you don't follow me on Instagram, Chris Garcia DPT, we now are helping stem cell clients all over the world. So if you don't follow that, do that at Stem Cell Recovery Experts on Instagram. And what we're really trying to do is help providers and help patients have a resource for the proper recovery, because we just had a physical therapist reach out to us personally and saying that they went through stem cell treatment and they themselves are stuck. And this is very, very normal. We see this all the time because it's not like a PRP injection. It's not like a post-surgical procedure. And so you have a lot of these variables. And so we've been doing it over the last few years. So we're just excited to share it with the world. So go ahead and follow there. All right. Why are we talking about I don't know what to do? So this week I was very fortunate to present online to a DPT class at Widener University, and during that time we had a couple questions from students. And one question, his name is Jared, I'll call him out. Jared, is a great question. He asked, what do you do to help conquer your weaknesses? And, one of the things I've learned in leadership and helping people become just better within themselves and better clinicians is help them be more introspective versus giving responses and giving answers. And so I asked Jared, I said, what's your weakness? What are you concerned about? And, what are you fearful of? And he said, I am concerned that I'm not going to know the answer for a patient right in front of me, and I'm not going to know what to say. And I said, that's a legitimate fear. But the reality is, as you go through your practice, I still encounter things. I'm 15 years in, gone through a sports residency, did pro sports. I was a concierge physical therapist. I traveled all over the world managing athletes. I've done the NFL combine training. I've been in scenarios where I don't have the answer. I've been in tournaments, in live tournaments with dislocated fingers, hip displacements, tibial plateau fractures, you name it. And there's so many different scenarios that you don't know exactly what to do, but you do have to follow some guidelines. And I'm going to share that with you today because each and every one of you listening to this have those same fears and apprehensions, and some of you would call them weaknesses. I call them area of improvements. But the reality is, throughout your process, throughout your entire career, you're going to have these things. So the sooner that you can develop a process to conquer it or know how to manage it, that's where you're going to actually just surpass all of your peers. And that's what you're really looking for, how to develop that confidence. Some people say, I don't want to have imposter syndrome, but it has nothing to do with that. It really comes down to how do you create a better framework within yourself to be able to manage any case that you don't know what to do. And I've been able to do that successfully, and I want you to be able to do the same. So that's why we're having this podcast. So thanks, Jared at Widener. It's been great to be able to help students, but also clinicians, because you share the same concerns. So all right, so let me give you a little bit of an outline, right? So we have, you might have a patient who just came to see you for a very complex post-surgical procedure, or maybe you've never seen a lot of sciatica or lumbar disc herniations, and I'm just making this case up. And this person's a very active individual, and they're asking you, you ready for this? Should I have surgery or not, right? Somebody has a complex case, and they've gone to numerous clinicians, numerous specialists. They've been to massage therapists, chiropractors, physical therapists, done everything in the wheelhouse. Now they're consulting with you because you're a cash-based physical therapist. They're looking for something different. They're assuming you have more skills, you have more experience and history, and now you're stuck with, oh my gosh, what do I do with this? This is a very tough case, and on textbook, on paper, it might sound a little easier, but when they're right in front of you, that's where we all have these nerves. And I'll show you how to settle these down and go through it and really beat the whole process and being truthful. And when you can do that internally without practice, it shows that you have that confidence, whether you know everything you're about to do or you know nothing. And when you look at this case, you probably spoke to them over the phone, or you had somebody on your team answer that call for you, and now you know what's coming in. And now they're at the initial evaluation. They're right in front of you, and they're going through these things, and you're asking them all these questions. What have you been through? What are you still suffering from? What do you want to be able to do? And they say, you know, I want to be able to walk. I want to be able to pick up my kids. I want to be able to get out of the bed without numbness and tingling going down my leg. I want to be able to do it without this atrophy I have in my leg. I haven't been able to bend forward. I can't sit for long periods of time. And so you look at this, you're like, wow, that's a long plan of care. This is going to take me a long time to get there, because it's taken them maybe months to years to get to that point. So your question then becomes, how am I going to help this person, and what am I going to tell them? How long is it going to take them? Can I even help? And they're asking, number one, can you help me? Number two, what type of improvement should I expect? And number three, or should I have surgery? Wow. And now they're expecting an answer from you. And as a sports physical therapist, you're now looking at them, blank stare in the eye, deer in the headlights. And this is where the confidence becomes a problem. And so you start backpedaling, you start over talking, and they can sense that, right? You start rambling. And as you can see, most physical therapists don't feel confident in something, they just keep talking. And so the patient is severely confused, because you went one direction, you don't know what to say on the other. And the worst thing you want to do is say nothing, because then that shows you actually have nothing to say, and you don't have any confidence in what you're saying right now. So, all right, so I'm going to go through the step-by-step process to be able to help you conquer this. So being honest and truthful is the best thing. However, you don't want to seem incompetent, right? You want to be able to help this person and guide them, right? So the first thing to hit right off the top of the head is, I completely understand, and you have an extensive medical history, and the great news is you're going to be in good hands. All right, so what that does is it helps the person understand that you are with them, you're on their side. And so the next step is, all right, what are we going to do here? So if you don't know everything right there and then, your next step is to figure out, okay, after this session, tonight, the next day, that whole week, you're going to be reaching out to resources, right? So you're going to be reaching out to local surgeons. You're going to be talking to peers who've seen these type of things. You're going to probably be on PubMed. You're going to be on Google, searching for everything and anything possible to look at, what do I do in this case? You might go to a mentor. You might go to an old professor. You might go to a surgeon and look at, okay, what are the outcomes? Which direction should I go? So you're going to look at clinical prediction rules. You're going to look at guidelines, protocols, all these other things. Here's the problem. You want to be able to get there tonight, tomorrow, next week. The patient wants to be able to get an answer right now. So here's how you buy yourself some time with being honest. All right. Hi, Jerry, patient. I'm going to look at, I see your case. It's quite extensive. One of the things I want to do is, with 100% certainty, give you all the answers in terms of how long this is going to take, exactly what's going to happen in every process. And while I have seen cases similar to this, I don't want to give you poor information or bad information. So what I'm going to do over the next week, because I'm going to see you on Tuesday or Thursday of next week, whenever that date is, I'm going to do an extensive amount of research to give you the best answers possible. Today was really about getting an understanding of what you expect and what you want and then where you want to go. Now that I have all this information, I'm going to do some back-end research, talk to my colleagues, talk to my experts, but just know by next week, I'll have all that information and be able to present that to you to give you accurate information so you can feel confident that I'm the best person that's going to help you. What you've done there is you've outlined that one, they're in good hands. Why? Because two, you genuinely care to do all the research behind that. Now, the worst thing you can do is say, yep, no problem, I'll go ahead and take care of you. You don't necessarily put on an outline. You just tell them, yep, you're basically promising the results that they need and that you're actually lying. And you might say, well, I don't know what else to say. I think you have to be honest and say, listen, I'm going to do everything on the back end, and next time I talk to you, I'll give you everything step by step on what I expect. And that is genuine and it's honest. And because of that, you don't feel bad because you're telling them the truth. The problem becomes is that most physical therapists can't do that. They have that hard balance of, well, I don't want to seem incompetent in what I do. And because of that, you say less or you say too much. So I don't know what's worse, taking your previous approach or saying nothing. And all you're doing here is you're saying something with intent, with confidence, with honesty, with genuineness. Now picture yourself in that same position. If you had that back pain and you were trying to figure out the final solution to what to do, what would you do? What would you want? You would want a surgeon or a healthcare provider to tell you exactly what I just outlined. Why? Because that's all you're looking for. You're just looking for a truth. You want somebody to give you an answer, point you in the right direction, and that's all this patient is. But your pride, the white coat in you, maybe you have a doctorate now that's like you're supposed to always be the best, you're always supposed to have the answer. It's your internal barrier that's limiting that patient from getting the service they need. I tell people this all the time. Stop being the doctor of physical therapy and just be you. And the minute you can do that, you allow yourself this freedom to be who you are, let your personality come through. And that's all that patients really appreciate. They still want the technical skill and everything that you can provide, but the more human you are, it allows them to see how much you genuinely are passionate about getting them better because no one else has done that. So if they go to 4 or 5 other clinicians who took that same old approach, I'll call it the insurance-based approach, that they gave them a stereotypical answer, you're going to do great, you're going to do fine. They go through this whole protocol that's systematic and doesn't really go above and beyond. You probably got into cash-based physical therapy because you wanted to provide something different. You were willing to put in those hours, after hours. You were trying to, do the best possible thing to get the best outcomes and get patients better. So if that's the intent of why you did this, to become that provider who can do a little bit more personalized one-on-one care. The gap between being able to do that and having that patient in front of you, that's the gap. And the way you overcome that gap is authenticity and using this exact same framework. And all you're doing is you're giving yourself some time, you're buying some time to find what the best answers would be. And so what you can do on the front end is if you are concerned about this in the future, right? So say you've had this in the past and you're like, gosh, I never want to do that again. What you do is you line up this initial evaluation as a consultation. And what this allows the customer or the patient to do is understand that you're not going to get any treatment, or maybe you do a baseline level of treatment, but it's more to figure out if we're going to be a good fit. And that way you're not concerned that you need to over deliver. And I think that patients would appreciate that if they know that this is a consultation, and if there's no treatment, they're here to figure out, can you help them? Right? If you were to go to an attorney, if you were to go to a dentist, sometimes they just do the consultation. Why? Because they don't want to overpromise. They don't want to say, this is the best place for you. I'm going to go do this treatment plan. I'm going to do all these different techniques. And if it doesn't work out, they look bad. So to protect yourself, what you do is say, hey, listen, I want to make sure that we can help. So I'm going to do a consultation, which will be no treatment. We're just going to go through your medical profile and give you a plan. And then we'll figure out from there if we're going to be the best. And what that does is it helps the patient with better expectations so that they can come in knowing, oh, I understand. You're not saying that you're going to be able to deliver this. You're asking if this is going to be the next step. That's perfect. And when you have two people who have the proper expectations and you can deliver on those, that's a great relationship. And that's where everything starts with patients. I think that you think that they want you to, or they expect you to deliver on everything, know every procedure that's ever come out, and you're over here saying or thinking, gosh, I have no idea what I'm doing. And the reality is that comes through, especially as you speak. If you're speaking too much, too fast, you're not looking them straight in the eye just because you're not confident, and patients will read through that. So if you've ever felt that way and you never want to feel that way, use this framework. If you're a third year physical therapy student, just like Jared, you just know these are very normal. And it's not experience that gets you through this. You know, people say all the time, well, find a mentor, get some experience, and go get this under your belt. You can get this before you even have experience. Just use this framework. Be honest. I don't think you need experience to go through this. How about you just use this? And the problem is that one of my passions is communicating with patients, communicating with PTs, and the strength that a lot of great physical therapists have is that communication and being able to phrase things so simply, so eloquently that a 6-year-old can understand that. And that's where physical therapists struggle, because you want to get to the nitty-gritty, what I call the operational things, the technical skill. I just want to mobilize them. I just want to do this. But you have a hard time conveying that to the person in front of you. You're like, with this, the knee valgus and the inclinometer angle of the superior dome of the tail, like the patient has no understanding. So if you can simplify things, the patient doesn't want to know any of that. They just want to know, are you the person for me? And are you going to give me the results that I want? Absolutely. That's it. That's all they want to know. So if you don't know what to say, I highly recommend, where I've always first started, is writing it out either on a whiteboard, on a computer. Just write it out, and on a piece of paper, whatever it is, and read it out loud. And you'll realize the way you write is not how you speak. So then compare that with, take a voice note. Say it out loud and just speak through that voice note, and then listen to it. And that's how you sound when you're talking to a patient. So the way you write and the way you speak are two different things, and just make sure that conveys that same authenticity. Now, don't try and script it, but understand how you phrase things. Does that sound like you? And that patient, when listening, can they interpret that at a 6th grade level? And that ultimately will give you that confidence. So when you don't know what to do, this could be for any region, neck, shoulder, knee, low backs, it doesn't even matter. It doesn't even matter the condition. It's when you don't know what to do, here's what to do. So the next time you're stuck, get a whiteboard, get your voice notes out, say it out loud, communicate it. What you don't have to say is, I'm not confident. Just say, I understand this is complex. I've seen things like this before. I want to make sure with 100% certainty that we can get you the plan that you need and in the hands that you need. So what I'm going to do on the back end, I'm going to meet with several people. I'm going to do all the research. So by the time I see you next time, I'll have an exact plan of the right direction to go. And the next thing you have to do is provide 1 or 2 options. If you want to go surgery, this is what I would recommend. If you want to go conservative care, this is what it would look like. And now you have that patient who's looking at, well, 1 year of post-surgical care or 6 months to a year of non-operative care, and now they get to make that decision. So now you've taken the uncertainty and the lack of confidence from yourself and given that to the patient so they can make a decision for themselves, and you've not felt bad about it, and you don't look incompetent. So if you're like Jared and you want to improve your weaknesses and seem like a confident physical therapist, no matter what hits you, no matter what type of case hits you, these are the things that you need to do. And if you're a cash-based physical therapist and you struggle with these things, you know this is going to be part of the evolution of your growth. It won't just be more skills, more experience. That's not going to be the case. And you need help with that framework on what to do, how to do it when you know exactly what to do, refining when you don't know exactly what not to do. And if you're stuck and you're looking for a better framework, a better way to attack patient cases, both complex and easy, I want you to highly consider taking my Cash PT Clinical Elevation course. This is an 8-week online mentorship course where I take cash-based physical therapists week by week into what an initial evaluation look like, what follow-up sessions should look like, what should your packages look like, ways to convey what you're doing, how to communicate with people, what to do when you don't know what you're doing. All of these things in a cash pay setting are very critical. Why? Because the customer is paying you out of pocket and they can leave you at any moment. Now, while you were an insurance-based provider, everything worked because that customer had a low barrier of entry and it was very easy for them to come back. Why? Because you were cheap. Now that you've started charging reasonable prices for what you do, you have to understand every session is a critical session. And if you don't figure this out, you're losing revenue, you're wasting time. And I've said this before in previous podcasts. People can lose anywhere from $50,000 to $150,000 in their first 3 to 5 years of being a cash PT. Now, if you can streamline that and avoid those, that'd be a better position. And for those of you who are joining my elevation course this year, I'm excited to see you in there. If you've been contemplating it, go ahead and head over to the website, drchrisgarcia.com/elevation to get more information. And I'm excited to see you in the course. If I don't see you in the course, I'll see you guys on the next episode. Take care. Hi, if you found this video helpful, please give it a thumbs up. Don't forget to subscribe and hit the bell notification for my weekly tips on treating cash pay patients, becoming that expert in your community, and thriving in business. Thanks, and I'll see you soon.